I know we've been talking about quite a bit about the reimbursement issues, some of the challenges operators are facing. Things like Medicare Part D copayments are obviously a rising challenge, as well as the reimbursement rate under the Medicaid long-term care program. So, talk to me a little bit about some of the struggles that you're having in terms of the current rate and reimbursement and your ability to keep up with some of the rising costs.
As you know, in order to provide quality of care as well as a good quantity of care, you have to have enough money to do so. Minimum wage, we have 2 small 6-bed facilities, so minimum wage we're paying our staff pretty much because we also pay for activities, we also pay for outings and different things like that. In order to do that and to stay viable and keep thriving, Medicaid is going to have to come up off of a little bit more money in order for us to really help our seniors and to really increase their well-being.
Rising acuity, Tina, has been one of the big concerns that I've been hearing a lot about from some of my colleagues, and certainly as we get into this period of time where dementia continues to be the tsunami, the silver tsunami as they call it, and the wave of dementia patients that are coming our way. I mean, I don't know about you, but I know my facility and a lot of other facilities are really sort of struggling with this notion we have one static rate for reimbursement of care. So, how does that affect your ability to keep up with rising costs?
When you can only pay your staff minimum wage and you want to do extra because they're going above and beyond and because they're passionate, you can't do it. And I definitely don't think that people get that and see that until they're in our shoes.
So I just wanted to kind of get a few thoughts from you about what your view was on how the funding methodology needs to change. Do you support a tiered payment system? Would you like to see just sort of across the board rate increase? How do you feel the funding methodology should change?
I think for me, if it was tiered or if it was just across the board, I think that would be fine because it's going to be regulated regardless. So even if it's a tiered payment, that might be even better because now you're dealing with people that need a higher acuity of care, but then they're going to get the monies that come behind that as well.